Parkrun is an effective social prescription because it promotes activity at all levels. You don't have to run, you can walk, you can volunteer, and also it's the social connections that you make. Parkrun is a great initiative because it connects all the people and binds them together.
There are so many amazing things that are happening in town. For example, on Saturday mornings we have parkrun, and then BAM we host some free art therapy lessons, and we collect a lot of granny squares to decorate our town, which we call it the Yarn Bombing Project. And then down the road we have the women's shed, we've got the men's shed, we've got an open art class across the road. It's endless the amount of things that are on offer in our beautiful small town.
Our town unfortunately has got some pretty bad statistics around diabetes. We're certainly on the higher end of the scale, and that's not where we want to be. So having opportunities like the Park Run, which wrap around our beautiful Meehai River for people to just come, run, walk, socialise, volunteer is just amazing. Doesn't cost anything.
Healthcare sectors now need to start thinking holistically about our population if we want to see our population more healthier and prevent repeated admissions to hospital, whether it's heart failure related or whether it is diabetes related.
Primary health networks are commissioning bodies that identify areas of health needs in communities. The PHN provides funding to primary health care providers that operate services such as the Diabetes Alliance Plus program.
My role in the Diabetes Alliance is as one of the senior clinicians providing GP education and group consultations. In Australia, on average, 1 in 7 to 8 adults will have diabetes. Some of those won't know that they have diabetes because in the early years it is an asymptomatic disease. In the clinical medical space, we're used to prescribing medications for different diseases, and certainly there is a range of medications you can use for diabetes, but we know that exercise is a key component to maintaining good health and helps reduce the risk of diabetes, as well as if you do have diabetes, the ease of control of diabetes and improving insulin resistance.
Pies 10 Aboriginal Corporation is an Aboriginal controlled community organisation. Cecil has been one of our success stories. He's got a fire in his belly about the Alliance, and he's going to be an incredible leader, and that's what I think we need with this program. We need local people to be the leaders of the program.
I would love to see in our mob be more physically active. For thousands of years, our mob, we had to hunt and gather our food. That was our exercise, and if we didn't do that, we starved. No.
Diet and nutrition is a really important part of diabetes. It is one of the main treatments for diabetes. It's about encouraging the best of what we have and what we eat and drink and move and use within our body. Parkrun is a great example of a social prescription that us as clinicians can encourage our patients and clients to attend. It's a great time for a chat, but also a good opportunity to get healthy and move and show a good example to our patients and clients as well.
Parkruns take place in around 500 communities across Australia every Saturday morning, and increasingly we're seeing clinicians and health services refer their patients to our events to help improve their physical health, their mental health, and also their social connections. Parkrun is proud to collaborate with the Diabetes Alliance, and as an organisation we're committed to supporting health services to build a relationship with their local parkrun and in turn to be able to signpost patients to those events.
It's really important for patients, for us as a community, to destigmatise the disease and to encourage people to get out, to move, and to do that sometimes in a group sort of social pattern is probably more effective. And it also encourages people to keep going, because sometimes people feel that they're not doing it for themselves then, if they're in a group, that there are other people who motivate them to get out and look after their general health, and as a result their diabetes will also follow through.
So as a GP, I see people every day who could benefit from more social connectedness and from moving more, and just starting that conversation about how are they going, what are they doing for physical activity, do they move much during the day, who do they see through the day. That can then lead you into conversations where you start to discover a lot more about people, that actually they have some really big unmet needs that you can help them with. So parkrun is a great entry for social prescribing for all clinicians because it's widely available and it's easy and it's free. We've got really good evidence that parkrun helps to make people healthier and happier. That's what they tell us.
I come down to parkrun every week because of the community that we have created here. At parkrun, you can walk, you can run, or you can volunteer, you can bring your baby in a pram, you can bring your dog, and you can just have a good time. I come because it gets me out of bed on Saturday morning, which is very important. The cafe after parkrun is one of the highlights of my morning. The fellowship and the friendships, and you just talk about your normal week, what's happened to you during the week.
Mate, what inspired me was the betterment of my health for me, and to show my mob and my family and the whole community that you look after yourself healthier and just love being healthy.